Welcome back to the video series. In this video, we will talk about applied behavior analysis. This is another type of therapy that therapists use with their patients. Applied behavior analysis is a science that focuses on studying a person's specific behaviors as a form of therapy. It increases helpful behaviors while decreasing behaviors that negatively affect learning. ABA can help reduce problem behaviors in children and reinforce positive behaviors. So, where did applied behavior analysis come from? Well, B.F. Skinner was the first to publish the basic sciences of ABA in the 1930s. This was due to finding that the evolutionary biology, physiology, and biological functionalism were contributing factors in the development of anyone. Then, John B. Watson believed that psychology should concern itself with the observable behaviors instead of internal events of an individual. We discussed what is ABA, how psychologists use it, and its history, but we have not discussed how it helps the patients. Well, ABA improves social interactions, helps patients learn new skills, and again reinforce positive behavior. This is important to patients with autism spectrum disorder, as one of the things that they have a hard time with is social interaction. Patients with autism have varying difficulties as it depends on patient to patient. The therapists see what they need to work on with the patient and then help them. For example, a common thing between all patients with autism is a lack of communication. Now again, it is important to remember that the individuals with autism are at different levels when it comes to social communication. A skill that a therapist might work on with them is how to respond to a greeting. A way that the therapist may accomplish this is by first initiating something like, "Hi, my name is Riley." Now the patient needs to respond by saying hi. Sometimes the patient may respond, or sometimes the therapist needs to prompt the patient to respond. And the therapist may do that by saying like, "Oh, you could say hi too." And when the patient accomplishes this, they are rewarded greatly. This is a cycle that the therapist works on with the patient and rewards them whenever that they behave like they're supposed to. And now, this reward system starts to fade away after some time. This is because in the real world, there are not really any rewards. So the therapist may start to then practice with the patient about natural rewards. Going back to the example, the therapist shows how a reward could be someone responding back to a greeting, someone waving at you, or someone starting a conversation with them. Besides developmental disabilities and autism, ABA has helped many others as well. Especially during the COVID-19, ABA has helped in managing lifestyle challenges. The idea of reinforcing positive behaviors is actually something that new parents are taking into consideration with their children. When their child is a toddler, parents encourage positive behavior by rewarding prizes or other rewards. Although there are no rewards when doing ABA, the reward is feeling healthier and more stable. I hope you learned something new, and I hope to see you next time.